Peace and blessings, people. So we're here at the clinic. We're finally here. And now you're going to actually be able to see what using food as medicine is like. We're going to see how they make the food here, how they do all of these collateral treatments that they do that are natural, that are healing to you. So I'm really excited about this today. Let's get started.
All right, let's go.
Can you talk a little bit about how you guys evaluate patients in the beginning a little bit differently versus how you would typically do it if you were in the hospital?
So I'll give you a little bit of background because, when I got into this whole, arena, as we talked about in our earlier conversation, started with my transition, then I started applying it to patients. Patients will come in, see them on lots of medications and they've had surgeries. And so it was a core to the question, what's your lifestyle? But I focused on what you ate because that was a key part of the lifestyle.
Gotcha.
And then the next approach was to say, okay, look, you're going to do some fundamental change in what you eat.
Yeah.
And so I would early on zoned in on the food aspect of things. And that was before I had, all the support systems we have now. That was one approach. The other part to that approach was that I would see them very soon after. It wasn't a typical, okay, do this and I'll see you in 3-4 months, 6 months. No. I'm going to see you next week. It allowed me to see the patient soon after because they go through a lot of acute changes.
Yeah.
And it helps them stay compliant for just 1 week.
Gotcha. Because they know they're coming back.
That's right. They know they're coming back. And then we can reassess and then go another week and another week. So that was, I would say, the foundation to the transition of our assessment from doing typical medicine to this integrative approach. It started with the food and it started with frequent follow-ups. And that was also associated with, medication weaning because at that time I was really keen on the adverse effects of multiple medications.
What kind of questions are you asking them when they come in? Because, again, like when you go in to see your doctor, they're just taking vitals, maybe asking, did anything change or anything like that? But what are some of those different questions that you're asking?
So fast forward to now, my primary leading question, I would say at least 75% of the time, is what brings you here today?
Gotcha.
I ask that question, it's very open-ended because it does several things.
Okay.
It allows the patient to tell me in their own words why they're here. Now, one may jump to the assumption, well, of course, they've got some chronic illness, or they've got this, that, and the other.
Gotcha.
But that's not the whole story. The whole story may be that loved one died last week and I'm grieving.
Yeah.
So that gives me more. That tells me, oh, you're here because A, maybe you were afraid you lost some friends or loved ones. It tells me that, okay, maybe you're aware of a disease or you're concerned about a disease, but it gives me more background. It gives me more dimensions in terms of what your motivation is,
Gotcha.
why you're here, what's bringing you here, because that helps me in terms of approaching you. It doesn't matter what kind of treatments I have or whatever the case is. I want to know what problem you're bringing. I want to say, okay, how can we as a team help you solve this problem? So that's the opening question. And so the patient tells their story. That gives me lots of information. All of that stuff gives me insight, some behavior, or they're depressed, and so on and so forth. So that gives me a volume of information to work. I want to help the patient in a multidimensional fashion, not just, okay, you got this diagnosis, this label, and this is what we're going to do.
Right.
Which is counter to the way we're trained nowadays.
Right.
Diagnostic label, indicated medication, we're done.
Treat the number, not the patient.
That's exactly right.
Yeah, and I think that's really important because one of the things I do when I sort of work with people is I'm evaluating how many bowel movements are you having a day? How much water are you drinking? Tell me about your sleep. Are you getting sound sleep? Are you waking up during the night?
That's right.
When you wake up, are you waking up to urinate? Or are you just waking up and you can't go back to sleep?
That's important.
So you start to ask these questions and you start to see how their lifestyle in totality is being affected.
Yep.
And now you can kind of start to see where these symptoms are starting to point to.
So this is our digital health center. This is the area that I'm most excited about. And these guys are the hero of the clinic. They don't know it. I try not to tell them, but they're the heroes of the clinic. Because this is how we stay in touch with our patients when they're not here. And so we get patient digital health. We got people from all over the country. And we will set up digital health calls. So let's say, for instance, someone came in, we made adjustments in the medication, we weaned them off something, we put them on a new diet. It's okay, go home, we're going to see you in the office in maybe 4 weeks, but I need a digital health call in 1 week and then 2 weeks, etc. Just check out exactly how are you doing, Mr. So-and-so. So it's our eyes and ears.
Oh, the ozone room, man. Had I known, I would have set up an appointment.
Oh my goodness!
Yeah, man, I would set up an appointment.
Well, you're in Houston regularly, so you know where to find us now. So we do EBOO, which is the highest form, and so we do the double stick, as you know, and running through, we've had great success. And
Yeah.
so, in fact, I came here Saturday morning to get my treatment because, we're so busy. I can't, get my treatments otherwise.
Because this is one of the things that I always recommend for my sickle cell patients.
Oh, really?
Like when people come to me with sickle cell issues,
Wow.
I'm like,
Intravenous ozone.
typically I see people always using this when they're having issues with infections,
Yep.
having cancer issues.
Yep. what I
And
see.
so if it can help a patient from that standpoint, then
Yep.
what harm could it do with somebody who's
Sickle
sickle cell?
Wow.
You know, and when you think about some of the benefits of ozone therapy, and we think about what sickle
Yes.
cell is, a sickling of the cell,
Makes sense.
and an issue with, getting oxygen into the cell,
Yep.
then
Yep.
it makes sense to do an ozone treatment. One of the questions I have for you, because I had to go through this myself, working in a hospital, constantly the only therapy I can think of or have the opportunity to use is medication.
Yep.
And so it was a huge transition for me to go from that mindset to the holistic mindset. Well, now I got to look at the whole patient. I can't just
right.
look at the blood
That's right.
with diabetes. Now I have to look at the whole patient. I got to look at the insulin resistance. I got to
right.
look at the eating habits.
That's right.
I got to look at this whole patient. How was
right.
that transition for you?
Yeah, it's interesting because I started out my practice doing invasive procedures and 16 hours a day, weekdays, 12 on weekends, in the lab doing this procedure, that
Right.
procedure. So I went from that, reductionist approach as you mentioned, and I transitioned to this. And when I started using nutrition and I saw the changes, I said, well, wow, this is amazing. And I think the earliest part of the transition was, okay, A, I'm dealing with the whole patient. B, I need to be more aggressive in weaning medication. Even though I wanted to wean medication, the medication we had to be more aggressive, especially people that had great success early on.
Gotcha.
Blood pressure dropping with a lady that passed out. She was on a detox and we didn't wean her blood pressure medicine fast enough.
Which is the beautiful thing about natural medicine or food as medicine is that it always finds this homeostatic point that is normal, that is healthy for you. But the dangerous thing about medications is it doesn't know that set point.
That's right.
And so it will reduce until you're dead.
That's right.
I
mean, that's a great point because when people are taking drugs like insulin
Yep.
or anything that can drop the blood sugar, you can have hypoglycemia,
Yep.
which is severe, very low blood sugar, and people, getting serious problems. So I'll stop schedule insulin and I'll say, okay, if your blood sugar goes above 200 or above 250, depending on where their baseline was,
Yeah.
then you take this amount.
So you'll put them on sliding scale.
There's a sliding scale, and a very simple sliding scale, and we would see them quickly after, and we still do that now through our
Yeah.
digital health clinic and other things. So the importance is to see how they're doing. So after about a week or two, people will come in, and they're not taking insulin for that whole week or two, and say, okay, we're in good shape. Now their blood sugar may be 180, 190, sometimes 210.
Right.
I'm okay with that,
Yeah.
because I know it's going to come down over time some more.
Right.
Problem is that if it drops to 5, they can't call me.
Right.
If it's at 400, they can call me. My blood sugar's 400. Okay, take more.
Yeah,
insulin.
absolutely.
So that's the thing I
Drop to
explained.
5, they're not calling
They're not calling
anybody.
anybody. That's right.
Medical emergency situation or acute situation, you're put on medication.
That's right.
Okay, but again, they're just like supplements. They're not the foundation of health.
That's
when-
exactly right.
So when somebody has a headache, they don't have a deficiency in Excedrin. Okay, what they need to do is make sure they take care of the actual cause of it.
Yep.
Not the headache isn't the issue. Okay, there's an underlying problem that they need to address, and it's really important for people to know. It doesn't matter if it's prescription medications or something over the counter. It is something that if you take it in the meantime, you need to fix the real issue. And so I'm really glad that here you guys work really diligently on not only weaning them off of medications and removing medications, but in
Yep.
some cases even aggressively removing them from the start.
Our mantra is pharmaceuticals first and foremost, nutraceuticals as needed, pharmaceuticals as a last resort. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next